Hi, and thank you so much, the Walrus, for inviting me this evening for the talk on housing and a crisis that we've really had in our city, in our country, well before the pandemic, but has been compounded and imposing suffering and hurt on so many and thousands across the country right now. My name is Andrew Boozary. I'm a primary care physician with the Inner City Health Associates, as well as an executive director for social medicine and population health at the University Health Network. And really just hoping, really looking forward to the discussion with so many experts in the room on this issue and the learning to take place, but hoping to have a few reflections as someone, as a person who has benefited from social housing, whose family has over our time in Canada, as well as a primary care clinician, of not to speak for patients and communities, but I think where we've seen so much resilience and strength that I feel has been lost along the way and in the conversations, both pre-pandemic and currently, and really from a policy perspective about how for us to truly have a universal healthcare system, we really do need to see housing first and housing and health connected in ways that I don't believe we've made that fulsome connection in the way that we need to. Really, I think from the learnings that we've had through the pandemic, in the ways that so much of the inequities have been pulled back, have been magnified. Really, the curtain has been pulled back on inequities that for far too long we've really accepted as a country. And I think one of the hope that I have, and I know many share, is that we can actually build something better, but with people and with communities that best understand how the lack of housing, how homelessness has really upended people's lives, and the sort of supports and design that needs to take place for people to have the meaningful lives and choices that only they can make. And I think one of the pieces that we can't shirk any longer is just how racialized poverty and homelessness are in our country. We've seen this in terms of Black, Brown, and Indigenous communities through COVID. The latest data showing over 80% of COVID cases disproportionately harming communities of color, over 50% of the cases in Toronto affecting low-income households. And so much of this we're not even seeing in terms of the data is not capturing of the suffering that the pandemic has brought for people who have been underhoused and who are also grappling and struggling with the other pathologies of poverty that, again, we have long seen take hold in our country. And I really do also have to give so much credit to the community response through the pandemic. I think this is where the innovation has been to really rise up to the challenge early around the idea that when the public health messaging was stay at home if you can, for too many, for thousands, they couldn't. And we were fortunate as UHN to be able to partner with Parkdale Queen West Community Health Center, Inner City Health Associates, Toronto Public Health, the Neighborhood Group, and Inner City Family Health Team in trying to pull together hotel recovery sites for people experiencing homelessness as places to recover from COVID, but also get access to harm reduction supports and social and community supports that, again, have been far too long denied to people. And I think we can see just how much we need to have the audacity to get COVID to zero. We've had complacency with COVID and have initially set thresholds that were only inhumane for certain communities to experience going into this winter. But I also believe we need that same audacity to get homelessness to zero in our country. And it's a challenge and it's a mission that many in the room, that many in so many other spaces have been advocating for decades. And I believe that we've seen more and more evidence about just how tightly connected housing and health are. People who are experiencing homelessness before the pandemic would, not be expected to make it past their 55th birthday. We also know about how disproportionately concentrated disease and the burden of disease are for people who of mental health and physical health, of people living on the streets or sleeping rough, and people experiencing homelessness. And really, the task is on us, I believe, coming out of the pandemic and coming through the pandemic to protect people through the winter. We have now currently have over 1,000 people sleeping outside in encampments. And I know that it makes people uncomfortable seeing that, but it should only speak to our failure on housing. And if it creates such discomfort, then we need to see the housing take place. And I think it needs to be a call to action that people who have felt neglected and shut out of our shelter system, of our housing system, have had to respond with their own creativeness, with their own ingenuity to save their own lives. And I believe we really need to come together now like never before to address the housing crisis, COVID crisis, the overdose crisis, with the sort of complexity that has that we have not been willing to bring that collective effort for. That will require all policymakers, all levels of government, and public and private sector to really come together and acknowledge that we have long allowed life years to be siphoned away from people, and we need this response now if we're ever going to be able to talk about our country as one that puts health first.